Good afternoon, everyone. My name is Michelle, and I'm going to be your host today for our very special Ask the Expert webinar. We do this once a week, and we are very excited to be talking about a very pertinent topic today. So, today we're going to be discussing the mental health of young doctors and medical students. So, I am joined by a very, very special guest, Dr. Lerato Khatle. So Lerato has had an interesting journey through the healthcare sector, with influences from both the private and public sectors helping her fuel her curiosity, excitement, and conviction for the future of healthcare. This uncommon path has positioned her uniquely for the work she does on a daily basis and has inspired her to continue to make a case for the impact of the healthcare professional at the bedside and beyond. I know that this discussion is going to benefit many, as it is such a pertinent topic for young doctors and medical students. And I hope everyone is as excited as I am to hear all the invaluable information that Lerato is going to give us. Dr. Lerato, thank you so much for joining us today. It's going to be a very interesting discussion. So, yeah, welcome and thank you so much.
Thank you so much, Michelle. Thank you to you and the SADAG team. It's such a pleasure to be a part of the work that you all continue to do to make sure mental health is a priority in our country for everyone. So I'm really honored.
Thank you so much. And it's really a pleasure to have you with us today. So, anyone who is watching today, you're welcome to ask us questions in the comments below. And if we have time at the end, we will be answering some of those questions. Okay, so Dr. Lerato, I'm just going to be asking you some questions as well, just to gain a bit of background about who you are and what you do as well. Okay, so can you tell us a little bit more about your journey in becoming a doctor and what's been happening to your current position today? Like what has unfolded from the start of your journey up till now?
No problem. I will say that I wasn't sort of the typical person who studies medicine. I don't think it's something I believed I should be doing from a very young age. But in university, thought it's probably, I mean, in high school, thought it's something I could probably cope with in university. So I applied and was fortunate enough to get in at a few universities and ended up selecting Stellenbosch University, where I did my undergraduate degree for 6 years. And already then, I started to sort of pick up on some challenges that I thought were important to be addressed, but didn't necessarily understand how I would navigate them. That was around my third year. As a medical student, I was just keen and curious to finish my degree, start earning money. But more importantly, I really cared about pediatrics. And so that was the career path I thought I would be heading towards. I ended up graduating in 2015 and starting internship in Johannesburg at Helen Joseph Hospital, which is, I think, where the journey for me began about really recognizing some of the challenges that healthcare professionals face at large. So, regardless of whether you're a doctor, any healthcare professional, the challenges that we face in the environment. And that really encouraged me to try and do some things around it. So, I ended up starting to work closely with my intern curator and hospital CEO just to create solutions that would help the people around me, including myself. That curiosity has grown and continued to grow. And I found myself being this individual who cares about problems and cares particularly about problems that are facing healthcare professionals. There aren't a lot of entities or institutions that try to address issues that clinicians or healthcare professionals face. And that's why I'm also really appreciative of the work that SADAG does, is because you've committed to really looking carefully at the issues facing medical students and doctors. And I believe deeply in that. And so essentially, my journey evolved into making sure I did all the compulsory phases of service. So I finished internship, finished ComServe, but all the while was sort of developing this passion project where I was really trying to focus on how do you support doctors, building mentorship programs, applying to competitions, just to sort of understand how do you organize these types of ideas to add value and impact to the doctor, not in terms of making them a better doctor to an individual patient, but a better person for themselves so that they can actually have a career that they're enjoying. And I found myself through these experiences being exposed to environments where people actually do care about solving problems. And my current employer, Discovery, has also just been a huge partner in making sure I continue to do the things that I care about, alongside working with them to continue to add value to healthcare professionals. So I find myself in this very niche environment My role is health strategy, but it looks at the strategy that we use to actually support doctors to continue to thrive in the current healthcare context and landscape. I'm sure you'll understand that the economic status of our world, I wouldn't even say country, but also the new developments from technology to AI really do impact the way clinicians and doctors practice. And so I find myself doing that by day, but also continuing with some of my passion projects, which have a lot to do with empowering clinicians from a mentorship and a coaching perspective. And I really love that. I also am blessed that in these capacities I get to lead, which is something that I value deeply. And I really believe that leadership is a competence every doctor embodies every day. Whether they're the intern, whether they're the medical student, you're leading a patient before you towards their health. And I think it's a competence that all of us need to continue to develop. And all these things, when they come together, can create a complex environment to achieve mental health, which is why I'm really excited about the conversation we're going to be having today.
Oh, thank you so much for that, Lerato. I think it really just shows how much of an advocate you are for mental health. And I can see that you truly do. You can empathize with all young doctors and medical students out there, because you know that pouring from an empty cup, not only does it affect you mentally but also physically as well. And so it really is important that young doctors, and well, all doctors for that matter, any healthcare professional, they really do look after themselves so that they can perform to the best of their ability at their work and also enjoy their work, as you said. Okay, perfect. Thank you so much. We're going to move on to the next question. So, SADAG and Discovery have run the Discovery Young Doctors and Medical Students Helpline since 2017. So, Lerato, can you just please tell us a bit more about this helpline, why it is so important, and how does it support young doctors?
100%. So this helpline, as you said, is it's heading towards its 10-year mark in 2 years. So it's been around for a while. And the reason really being because around that 2017 mark, a really prominent professor in medicine at UCT died of mental health reasons. And that obviously caused a huge challenge generally for everybody who was affiliated or connected, but exposed us all to the reality of mental health facing healthcare professionals, whether they're young or they're old. And the helpline actually predates that event. But what we noticed when that event occurred was a huge spike in the call volumes. And I mean, the reason why the helpline exists is exactly that, to be help to young professionals who are navigating a very difficult transition. You can understand coming from high school, or all high schools around the world, that the challenges each individual student comes with are absolutely different. But what we've noticed with the calls and the pattern of calls that we see is the reasons why people are calling. Sometimes it's personal mental health related issues from depression and anxiety, but they're always connected to some sort of psychosocial or biopsychosocial issue, either their personal well-being or the realities of trying to navigate finance through university, and sometimes even basic needs like getting food. And so we've always believed in investing in the person behind the profession. And the mental health helpline for young doctors is exactly that. It's an opportunity to teach young professionals from a very early stage that their mental health is going to be one of the greatest tools they have with them. And with the support of SADC, we're able to provide this helpline service 24 hours for any medical student or doctor who calls in distress needing support. Sometimes people are actually in acute distress and need an intervention. Other times they just need the support to journey through challenging things. And as you can imagine, being a new student, not necessarily aware of the copious volumes of work that you need to get through, the support in terms of building relationships and friendships, and for some people being really far away from home, there are a lot of factors that make it difficult to navigate the degree as a whole. There's also the stigma of it being one of the most difficult degrees to begin with. So there are really many reasons why this investment remains important to us. But I think COVID-19 came, and again, this tsunami of mental health across the globe, despite what your profession was, reminding us about the need and the importance to maintain these environments where people can access mental health support. And at that time, we collaborated to even look to how we can support more senior clinicians through the Healthcare Workers Care Network that we work closely with SADC to develop. So as the years have gone by, we've continued to see the same similar trends in terms of call volumes, in terms of reasons for calling. But I think even more and more now, as people get familiar with the language of mental health, and I think from my personal experience as a growing clinician, who sometimes is able to try to dissociate, who sometimes is able to dissociate themselves from the theory. It's so important to create an environment where they can also lean in and be supported for the unique pressures that they face. So that's why we have the helpline. It's absolutely accessible to anybody who needs to use it. And although it's labeled Young Doctor Mental Health Helpline, even senior professionals who need the support could be supported on the line. So we care deeply about this, and we care deeply about as many young medical students and doctors knowing that this is available, because we know the pressures that exist are sudden sometimes, surprising, and can be really overwhelming to deal with alone.
Absolutely. Thank you so much, Lerato. I think that is an incredibly helpful resource. And I do encourage any doctor, healthcare professional out there to make use of this helpline, because you really don't have to suffer silently and you don't have to suffer alone. There's always help available. And so there's absolutely no shame in asking for assistance. So thank you so much, Lerato. I think that is really incredible. Okay, perfect. So, moving on, in your opinion, what is the toughest mental challenge young doctors face and how can they handle it?
I think this is a difficult question because to pin one down
It's
in today's
difficult.
world is really difficult. But I think I go
Yeah,
back to some key principles that we're exposed to in medicine, which is this idea of the biopsychosocial model, right? It speaks to this concept that any person is affected always by their personal biology, what's happening in their body, their genetics, their family history, their psychology, their mental state, and the things that may be influencing their mental state. We still live in a country where poverty is a real thing for very many people. So you may find young doctors coming into university for the first time from backgrounds that aren't necessarily very well off, right? And then this idea of the social model, the idea that our social reality, our social environment greatly impacts our well being. And so for me, when I think about what the biggest challenge is, it would be difficult to point it to one place, but I know that it's easier to just speak to what could be common in those areas. And we know now that mental health presentation is more common. We know that people are suffering from real illnesses like depression and anxiety that can make it very, very difficult to navigate life generally. But I also want to highlight the high functioning spectrum, right? A lot of the people who find themselves studying degrees like medicine may actually find themselves high functioning for both conditions. And what that looks like is typically very different. So they're not the people who might quite obviously experience a debilitation in every facet of their lives, but in fact be really struggling. So those are important things to look to in terms of what could be challenging from a biological perspective. And then the psychology, I think, is really connected to this social aspect. If you look at our world today, if you look at the reality of being a doctor in South Africa today, simple things like being employed after you've learned for 6 odd years are no longer a guarantee. And those things truly do affect the mental health and challenge medical students today around what it looks like. Everybody doesn't have the privilege of being able to prepare for overseas board exams, and we shouldn't have to. There's still such a huge need in terms of the resource of clinicians in South Africa that those things make it very difficult for anybody who's a medical student and sometimes even a doctor today to consider what it looks like to be safe, secure, and contributing meaningfully in the healthcare sector today. So I think for me, I wouldn't pick one challenge. I'm acutely aware that there's a bouquet of issues that make it a very complex challenge altogether, but all those are deeply valid and important to be aware of in order to journey towards better mental health.
absolutely, Lerato. And yeah, like you said, it is a very multifaceted concept with especially young mental health. Well, mental health issues in the youth and especially healthcare professionals. I liked what you said about the high functioning aspect of it, because with high functioning anxiety, especially people they just continue going and going and going. They push themselves so far and they don't know their limits. But eventually their body will react and their body will say, listen, you need to take a break. And eventually that's when the physical symptoms come in and it can be dangerous. So thank you for mentioning that. And I just hope that people become more aware of the dangers of high functioning anxiety and depression. So thank you so much for that. Okay, perfect. And then furthermore, what's one change you'd love to see in how mental health is handled in the medical field?
Sure. Again, I think I think this is a complex issue. But one thing I go back to is some of the principles that we're anchored by. As you know, usually doctors sign off sign a Hippocratic oath, which is their promise to practice in a particular way as it relates to patients. But also, if you're hired by the government in this country, there are a set of principles that govern how we work. It's called the Batupele principles. And one of them speaks to this idea of courtesy, which also goes back to the roots of our country and the ethos of this principle called Ubuntu. And I give that context to say that I think those are the types of things that need to change. First, we need to be able to appreciate that every single professional that walks into facility to deliver a service is a person. And once we begin to engage each other on a personal level and appreciate that all these people who are serving patients, managing patients, are not just bodies with a whole lot of knowledge that are here to do things on other sets of bodies that have a lot of problems. It's an interpersonal experience. And I think the one thing that the healthcare system needs is to almost take doctors off the throne of being some sort of a god and recognize that they are people, people who need support, people who need positive working environments, people who need to not be bullied, to not find themselves in toxic working environments. And those are all things that I think need to happen. So that's why I say the complexity exists in that our system is quite hierarchical. It depends on the type of leader before you, but that also depends on the type of ecosystem you find yourself working in. And I don't think there's anybody working in the healthcare sector today who can admit to not experiencing pressure. And that type of pressure can make us very mean people towards one another. And so I think that personal aspect is absolutely critical. Once we recognize that these are people before us, people with real lives, with real stories, with real problems, we can start to generate an environment where we're seen as such. And instead of being concerned that a person will break, we'll actually rally around them and try and make sure they can have a career of longevity, navigate hard times when there are hard times, but also be free to be human. And some of the harsher examples we see of this is simple things like if I were to report today that my family member passed away, but I was on call, surprisingly, it'd be very difficult to get someone to cover my call. And so there's so many instances of people who've had to navigate grief, navigate loss, navigate pregnancy miscarriages while moving along and acting like nothing's happening. So I think, and that's why I said I have a real passion for the professionals. I think our healthcare sector needs to be ready to see healthcare professionals as people first.
Absolutely. I 100% agree. I have spoken to a few nurses actually who have said, oh, the environment is so toxic, so a lot of nurses have left. But then the nurses who stay behind have to carry the slack that has been left. And they
Yeah,
end up working shifts that are absolutely ridiculous. They work for 48 hours at a time, if not more. And that really leads to, terrible physical outcomes like burnouts and even more serious health issues. And so I think it's really really important as well that doctors and nurses and any healthcare professional is allowed to have the rest that they need. But it also speaks to the shortage of professionals that we have, because unfortunately
100%.
when there is a shortage, the people who are there on shift, unfortunately they have to do the work. They can't go home. But I think maybe something needs to change systematically to cater,
100%.
yeah, cater for those doctors, because they are not superheroes at the end of the day. Yes, they are very knowledgeable and they do incredible things on a daily basis. They do need rest as well, and like you said, they are human. So they're not invincible, unfortunately. Yeah.
Yeah, I agree with you on that systems perspective. It's maybe something I didn't allude to quite overtly, but 100%. And I think part of system reorganizing actually means having doctors and nurses be a part of that conversation. I firmly believe that it's the people who are in a problem who can solve it best, not necessarily from a resource perspective, but from an idea perspective. And although sometimes it feels like you're talking to a stone wall, I do think that the voice of the doctor and the nurse and any healthcare professional matter in ideating for a system that serves them a bit better. Because to your point, as they work these harsh, hard hours, it's not going to show up in patient outcomes. It's not going to show up in patient care. Patients will and do suffer.
Absolutely, absolutely, and yeah, that draws back to our discussion earlier about not pouring from an empty cup. You
Yeah,
should always pour from a full cup, and it should be overflowing. So yeah, it's really incredible to see that doctors give so much of themselves to their patients, but at the same time, they don't have the time or the space to rebuild themselves, and it can affect many areas in their life. Yeah, so
100%.
yeah, thank you so much, Lerato. Okay, perfect. So, furthermore, what are some practical ways to create a routine that balances work and mental well-being for a healthcare professional?
I think this is such a beautiful question and it's such an important question, but it's also a question that doesn't have one perfect answer. If I look
Mm,
at my journey and my experience, I have really had to be a student of my own life and my own life's rhythms. And I think that's my first most important point is that you have to be willing to try, to fail, to make mistakes around creating rhythms and creating systems that support your mental well being. When you're an intern and things are really hard and really busy, you may not have the luxury of being able to go to the spa every other weekend. You may not even be able to have the luxury if you're living far from home to go home. So it's so important to be a student of your own rhythms and to try and create structures that support you. But under that, also being flexible, right? Being very flexible about what something can look like. I recall when I was internship, sometimes it was just a walk around the mall because I just needed to not be in the hospital and to not be in my bed and not necessarily spend money, but to be in a space where I'm giving myself time back, doing something I feel like I can enjoy. And then on top
mm,
of trying, I have found that it's sometimes it's like setting a goal in January to lose weight. We can be we can be really hard on ourselves when we set goals, when we don't prepare for the failure that comes with the process. You will slip up, something will go wrong, you will have an imperfect day, you won't necessarily always have the opportunity to go to your therapist. So what do you do when things go wrong? I think part of making a and creating a structure that actually works is thinking about how things can go wrong. And what I've come to learn is I do better when I time cycles. So my close friends and colleagues will know I work around 12-week cycles. If everything is great for me in my life, I try something for 3 months. And for 3 months, if I keep what works and I keep what doesn't work. And as it relates to my mental health, for me, it's anchored a lot around reading things that I enjoy, making time to be alone and having solitude, sometimes scuba diving if I can get that in. But that's not going to look the same in this 3 months as in the next 3 months. Also, the next 3 months is winter. So I might not be able to go to scuba. So I say that to say part of creating structure and rhythms is about trial and error, is about being flexible, but knowing yourself well enough to know what are the things that I enjoy. Something that you said earlier around clinicians and the overworking is, I guess, in some part, the reason why it works for many of them to even be in those environments for so long is because it fills them up to be in service of something. That's not
mm,
everybody. But just even knowing that is important. So you can try and create a rhythm where you're in service in other ways in your life that aren't necessarily being on call or being in the hospital. Maybe it's serving at church, maybe it's working at an old age home or volunteering. But it's going to require trying. And as the seasons of your life change, it's going to look exceptionally different. If you suddenly have a child or you suddenly get married, that rhythm needs to shift. So I think what's challenging is the reality that it's never going to look the same, but it's so important to be able to be clear about defining at least a time-based structure around activities you will do and you will commit to do for where you are in your mental health. And I once gave a talk last year, sorry for this long-winded answer, to a group of pediatricians, because I have personally struggled from high functioning depression and
mm,
have burnt out numerous times. So I bear those scars very loudly and proudly because I think it's so important for people to know that that is the story of how it goes. But with each burnout, I learned something. And one of the things that I learned is that my life is lived on a spectrum. And that's why I say I have a spectrum. If everything goes well, I can be strong and energized for my life for 12 weeks straight. But if things are a bit harder and there are more external pressures or there's more pressure at work, that window starts to narrow. And together with SADAG and another society last year or 2 years ago, we did a talk about recognizing what are the patterns of burnout and how they differ from when you're well. And I think knowing those things about yourself is important as well. If you're a person who enjoys a morning jog and you run a lot and suddenly you're not running, that's an indicator that your spectrum is narrowing. You're going to one extreme rather than staying in the middle, and that might be dangerous. If you're a person who doesn't eat a lot of takeout and you're suddenly always at the KFC line, that's an indicator that something's wrong. You're under pressure. Embarrassing story, but there was a time when I went to KFC every morning for breakfast, and I only recognized after that period that whoa, that's like that's not my pattern. But it's so important to journey through the self-awareness required to know your spectrum, to be prepared to try different things because you just don't know what you don't know, but then to be exceptionally lenient with the rhythms of your life. Because it's going to change. Sometimes it's going to be a favorite podcast, but if that podcast stops podcasting, what's next that you pick up? Maybe it's a book. There's no perfect answer, but I think I've learned through every burnout that it's so important to just set the 12-week timer and at the 11th week, prepare for what a shift looks like. Look at it again, reflect on it, what worked, what didn't work, and then be honest with your environment and be honest with the commitments that you have so that you can respond to your mental health based on where you are in your own personal spectrum. And those are hard conversations. It's not always easy to go to a boss or to a family member and say, I know I said I'd be doing this every weekend, but I actually can't anymore. Please, can I pick this up again in 6 weeks' time? And I've had to have conversations like that with my friends where I say, I don't have the capacity. I know I wanted to celebrate you and cook for you, but I'm burnt out. I can't do that. Can we postpone? So I think it takes a lot of vulnerability. It takes a lot of self awareness, but it and my biggest encouragement is just keep trying. Don't marry a method. Be very attuned to where you are and look for the creativity in finding the many ways of knowing something.
Absolutely. Well, thank you so much. I'm unmuted. Sorry, I just wanted to check. Thank you so much, Lerato. I think that was incredibly insightful, and I definitely think that many healthcare professionals can take your advice on board, because whilst you said that things work differently for different people, they can definitely they could incorporate this structure and this template that you have suggested, the 12-week plan. And I think it's really going to be effective for many people. And I strongly encourage people to use it as well. And I also really liked the point where you mentioned that, you have to recognize the signs of your own mental health, and being self aware is so incredibly important. And so once you recognize changes within yourself, maybe even a family member points something out to you, it's so important to be aware of that and to actually, pay attention to it and address it. So thank you so much, Lerato. That was incredibly insightful. Okay, I have one last question for you, and then we can, if we have a bit of time, we can go through to the comments section. So my last question is on the 5th of March, SADAG will be hosting a focus group to identify optimal mental health support for young doctors and medical students. So why is this so important, and how can doctors get involved?
Yeah, we really want to hear from this community, young medical doctors and medical students, because we know we live in a changing world, and we know that the way people engage resources is changing. And we just want to be honest and curious about the fact that even though we've had the helpline and we think it's been successful for the past 8 years, we want to understand what extra support or what additional support is this cohort of medical students and doctors looking to find. We also want to understand what's the easiest way or an easier way to access support. It's really just an opportunity for those people who feel like they can contribute to the conversation to come on board, help us share ideas so we can ensure that we're constantly creating environments and tools that are actually helpful and that are actually accessible and that you can reach when you need them. So we don't want to be presumptive. We don't want to assume that we know everything there is to know. We want to hear from the people who are having a lived experience as a student, who are having a lived experience as a young doctor, to understand what does it look like to support you with your mental health today, especially in this environment where resources are really gathering in terms of awareness. I think most people know mental health is a challenge, but as it pertains to actually using the resource, we want to understand what makes you use it, why do you choose to use it, and why do you keep coming back? Perhaps that's something we can continue to offer or scale up in how we communicate the message of the platform so that more people have access to the support and more people use it as readily and as necessarily as they need to.
I think that's brilliant. So thank you so much, Lerato. I think that is an incredible initiative to have, because, like you mentioned earlier, to have doctors themselves and nurses come up with suggestions on how things could be improved. It's all for the better because they are living in this experience and they know exactly firsthand what it's like. And so, yeah, I think that is really something amazing to get involved in for young doctors. So thank you so much. Okay, so we are running out of time. Um, so I just have one question here from Mohau. Um, they said, why is it that the healthcare space doesn't create these sacred spaces where they can become so much of themselves and not worry about fatigue, long hours? I speak as someone who is in the health space as a trainee nurse.
Thank you so much for that question. And hello, Mohau. Thank you for that question. I think also this answer is a painful one to respond to because I can resonate with what you're saying. There aren't necessarily enough environments that support us to be vulnerable. And it's actually something that I think about quite often as a leader. The reality is we are being led by multiple generations, and we find ourselves in a workplace where there are multiple generations, and multiple generations value things in different ways. And I think what makes our generation distinct is that we really, really care about the environment that we work in. And I'd encourage you to honestly, might sound cliche, but be the change you want to see. I think the environment starts changing when we decide we're going to behave differently in it. And if you follow the journey of my career, that's exactly the conviction I have, and that's how I operate. I don't do things because things were done to me. I do things because I believe they should be done moving forward. And I think it starts with us as the healthcare professionals in the environment making a conscious and concerted effort to be different and to create those spaces. I can think of moments when you're on call in the on call room where you can just extend kindness to someone. If you're on call with another intern or you're working with another nurse, what does it take to just take a moment and find out how their day was, ask about how their kids are? I think more than looking to why other people haven't done it, we need to start to introspect and wonder why, even though we need it, we choose not to do it.
Okay, perfect. Thank you so much for that, Lerato. I think that was incredibly insightful, and I'm sure I do hope that Mahal benefited from that, but I have no doubt that he will. And so, thank you so much for that. Okay, so I don't see any other questions in the comment section. So I think we could maybe wrap up here. Dr. Lerato, I just wanted to thank you so much for joining us today and for giving us your expertise. I have no doubt that many people have benefited from this webinar, and I certainly have as well. I have learned so much from you today. So thank you once again. And if anyone is struggling with their mental health at all, please don't hesitate to reach out to SADAG. We are open 24/7. Our helpline is 0800 567 567. And yeah, thank you so much for joining us today, Dr. Lerato.
Thank you for having me.
Of course. Thank you so much to everyone who joined, and have a wonderful weekend.